number of great folks lined up today to provide some updates for you on things that are going on for COVID-19. And we'll briefly outline some of those folks in a moment. Just a couple of housekeeping things. First of all, if our team could put the slides up for the call, we'd appreciate that. Thank you. And if just a few housekeeping things as we get started with our call this morning or this afternoon. If you could all make sure that you are on mute, both your microphone and your video. That would be helpful to all of us. We know there's a lot going on in wherever you're choosing to work from today, so we all are interested, but we'd love to have you be on mute for that. There should be a red line through both your microphone and your video icons on the bottom of the screen if you're logged in via computer. And again, if you're on your cell phone, please use your mute. Throughout the call, there's the opportunity to post your questions in the chat window if you are on the Zoom signed in to that application or via your PC. You can send that chat question to everyone or just send it privately to John Rizzo, who you'll see listed as one of the attendees there. We will collect those questions as we go along. We'll address them as we can. To view the chat dialogue, click the chat icon on the bottom of your screen, which I'm going to do for myself as well right now. So those are just some of the ground rules for today. Again, we've got a number of folks lined up for our call. You know, we did this call last week and had good response to it. People appreciated the fact that we didn't dwell on things too long. We moved pretty quickly, so we're going to try to do that today. We're not sure that we're going to do these every week, but because of the timing of the recent stimulus package being put out there and the other things that have been going on at the state level, federal level, we wanted to make sure we did that. I just want to just check quickly here with our team. Am I being received okay? Can everybody hear me?
Yes.
Okay, great. Just want to make sure. This is, as we all know, as we're talking into these boxes, we're not sure if anybody can hear us or not. So again, we thought the timing was good to do this, and we wanted to give an update both on what our health systems are seeing right now, what our county health department is seeing, but also talk a little bit about some of the stimulus activity and some of the things that are available for businesses, clarify some things. We also have a number of experts on the line with us today to provide answers to your questions as well. So our guests today on our call, before I get to those, I just want to remind folks of our gaccovid19.org website. This website is a great resource for lots of the updates and information that is coming across on COVID-19. We're trying to consolidate them along with our partners at the city, the county, and 20 or so other ecosystem partners in Greater Akron so that our community has information and resources at their fingertips. So please feel free to visit that. You'll also find recordings of last week's call and this week's call on that site. They'll be posted there, as well as many of the resources and information we're talking about today are being posted there with links to helpful places that will help you get through and get to what you need. So with that, let's switch over into our call. We have a number of folks with us today, and you see them listed on your screen. First, we're going to hear in a moment from Summit County Executive Eileen Shapiro about some news that was made last night by the county and some more resources for our small businesses. Donna Skota will talk with us a little bit about what we're seeing from Summit County Public Health in terms of the community's experience at the moment. Dr. Devney and Dr. Count will update us on things that their systems are seeing at both SUMA and Western Reserve. They were on our call last week and provide a lot of in-depth information. We were just asking them to give us a little bit of an update on what's been going on over the last week and what they see happening over the coming week. We have Steve Abenauer and Ed Lehner from both the clinic and Akron Children's Hospital. They have been particularly involved with the whole PPE sourcing issues and working closely with a number of community resources, suppliers and others to supply their systems. And so we'll hear a little bit about the experiences that they've been having. And then Lydia Mahalik will join us. She is with the Ohio Development Services Agency. She is the director of that agency. She will be talking about some of the state policy changes in support of our businesses for COVID-19. And we'll end with Congressman Anthony Gonzalez, who will tell us a little bit more about the Phase 3 stimulus package, the CARES Act, and some of the resources and changes outlined there. So I feel a little bit like a talk show host talking about all the great guests we're going to have here as we go forward, but we really do have a great lineup for you. So I'm going to start with Summit County Executive Eileen Shapiro. County Executive, can you tell us a little bit about just some of the broad support that's happening right now in the county, but more specifically, maybe update us on this Small Business Emergency Relief Grant Program that you announced last night?
Well, thank you, Steve. I'd start by first thanking everybody that's out there for pulling together as a community. I want to let you know that we are in constant contact with our mayors, our township trustees, our other elected officials on teleconference. Our emergency operations center is up and fully functional, and we are working with a vast myriad of partners across this community to keep our families safe and healthy. To Steve's point, last night I introduced at council a Summit County COVID-19 Small Business Emergency Relief Grant Program. We at the county felt that it was really important to get some grant money into the hands of especially our small businesses to help them pay rent and keep the lights on in this crucial time in their businesses. We have some criteria around it. It will be at max a $5,000 grant to somebody. Steve and other folks can give you the details, but the notion behind this was to put money in the hands of our small business people that have the best chance of being viable and keeping their business operating in a very difficult time, and then being able to leverage monies that are coming from the state and from the feds, and however we need to be able to do it. Our businesses are our lifeblood, and many of these small businesses have been shut down completely, and they are struggling to keep people on their payrolls, et cetera, et cetera. So the county has stood up with an initial $750,000 to establish the grant. We will encourage communities and business and our nonprofits and individuals, even if they would care to commit to the program. We believe that the demand for this will be great, and we would like to see us bring in as much money as quickly as possible into that. And to that end, I want to mention that the City of Akron and Jumpstart have each already committed $100,000 to the program to assist businesses in Summit County. And I can't thank the Chamber enough. This process will go through the Chamber, the application process, and I really commend them for standing up along with all of our other partners to help make this possible. And I believe the grant application process will start next week, so we really do want to get the money out quickly to these businesses. Steve?
Thank you, County Executive. And again, thank you to you and your team. It has been a tremendous pleasure to work with them through not only developing the grant program, but also all the other areas of response that we are coordinating in our community. It's vitally important, as we know, for everyone, including our businesses. Just a couple of additional points on the grant program that the County Executive outlined, and I lost my slide on that, but basically this grant program is for 3 to 25 employee businesses, and so the goal here is really to try to ensure that our businesses can make it through. And one of the key criteria for getting a grant is applying for one of the SBA loan programs that's available. Our goal, we have limited resources, and so our goal here is to try to get to those companies that have already kind of invested the time to put the loan application in and are going to get access to the larger support that is available at some point. We will have loans available for those who do not get approved, or grants available for those who do not get approved for the SBA loans, but we do want folks to go through the process of applying. That's the largest single source of funds that are available to help our businesses get through this. And we think it's very important that every business works down the path of trying to get access to the stimulus resources that have been provided through the CARES Act and through the the Economic Injury Disaster Loan Program. So the application is being finalized, and as the County Executive said, we'll be getting that information out as soon as we can. We envision being able to begin taking applications early next week. There is a little bit of information right now about what we're going through with the grant program on the GAC COVID-19.org website, as we had referenced before, and we will be using that and communicating back to folks through many partners about where the resources will be available and how to apply. So again, just keep track at gaccovid19.org. And if you do send an email to us, you can send an email to us about the loan program at the Greater Akron Chamber.org website. Can somebody give me that email address?
COVID grant.
Okay, so again, it's COVID grant at greaterakronchamber.org. And if you send us an email to covidgrant@greaterakronchamber.org, we will keep you in a queue, and when it's available, we will email out to let you know where to go. So With that, again, we really appreciate County Executive, your leadership on this. Immediately, you and Brian Nelson reached out to us to say you wanted to try to make these resources available. And I think it will help a number of our small businesses, as well as we are open to others that want to sort of provide resources for this fund. And we'd be happy to talk with any of you about that. You can contact me directly on that.
Thank you, Steve.
Yeah, thank you, County Executive. So moving on in our program here, I'm not sure if Donna Skota has joined us yet on the call. Donna, are you there?
Yeah, I'm here.
So Health Commissioner Donna Skota has been leading the charge here in the county on our readiness and response to COVID-19. Donna, could you just provide us a little bit of an update on the things that you've seen over the last week and what you expect to see as we push ahead there?
Yes, I will. Good afternoon, everyone. Thank you for joining us. Basically, at this point this morning, and I'm going to do these kind of as bulleted just for the sake of time. We today have 128 confirmed cases of COVID-19, and we currently have 8 deaths. Today, we will be releasing a zip code map. We've had lots of questions and inquiry from folks wanting to know where these cases are at. So we are releasing a zip code map today that will talk about, just the areas that do have confirmed cases. But I have to be very clear. This does not mean if an area is not in a colored area, it does not mean that you do not have COVID-19 circulating. There is widespread community spread. Having a white spot on the map should not give anyone any level of comfort. It's there, it's out there, it just means those cases have not been identified yet. And with limited testing available, we may never know all the cases and everywhere they're at. And on the notion of testing, we are still experiencing a critical shortage of test materials and the ability to do any sort of mass testing. Therefore, it makes it very difficult for us to know every single case that does occur. I want to remind everyone that 80 to 85% of these cases will recover on their own and need some non-pharmaceutical interventions, social distancing, self-quarantine, staying away from each other, washing your hands. Those folks will recover. They are not going to need any additional medical care or acute care settings. So I want to remind you that there's a lot of people out there that probably have COVID-19 that are not going to come across any medical providers area. They're just going to be in the community getting well. In regards to PPE, we still are collecting, we're getting people volunteering to give us their PPE. We are prioritizing that. We did receive one push from the Strategic National Stockpile, and what that means is orders were not filled, but rather they were just gave us some stuff that they had in the Strategic National Stockpile. And that's things like masks, gloves, gowns, those sorts of things. Those came to us. We gave 2/3 to the hospital, 1/3 to EMS, because you have to remember, those are frontline workers that we have to keep healthy in order to keep taking care of those that become most critically ill. And remember, these folks every single day go on the front lines and care for individuals. And they need to be protected when they're in these situations. We also, with some of the stuff we have been collecting, we are looking at a sort of another tier of groups that might need PPE, and it's things like group homes, congregate living sites, some of the mental health agencies, some of the folks that are continuing to provide services, and maybe never before this unprecedented time have had to ever have a need for PPE. So we are as well addressing those issues. Many of you may have seen we put out a request for volunteers. We've asked that our Medical Reserve Corps volunteer, as well as we have asked for anyone in the general public that would like to volunteer. There's the Ohio Responds site that you are able to go on and register. And that would help us a great deal if we knew we had some individuals that we could call up our volunteers. And I think that is it. We are locating some, it came off of an earlier call. We are identifying some guidance for businesses that we're putting out, as well as any videos that might be helpful to businesses to start to look for social distancing and that sort of stuff. I apologize, I have to go to our media briefing, but I am leaving you in the very capable hands of Tanya Burford, our Environmental Health Director, that can answer any of your questions on enforcement, and Corey Kendrick, who many of you know does business outreach and works with our businesses every day. So I apologize for having to leave, but they're quite capable of answering questions. Thank you.
Donna, thank you very much for your comments. I know there are some questions about the essential business order and enforcement on that. Because I know that we've got a couple of guests that have to leave at 1:30, I'm going to hold those questions for the end. One thing that we'd love to get, if we could get it from anybody from Donna's team, is the site where volunteers would want to go for information. If you could put that in the chat, that would be great.
Okay, great, we will.
Thank you very much.
Thank you.
So just turning to you, Dr. Devaney and Dr. Kent from Western Reserve Hospital. I keep wanting to call Dr. Kent Dr. West for some reason, at Western Reserve. But guys, could you give us an update as to what you're seeing in your systems right now, and how things are looking for both SUMA and for Western Reserve Hospital?
I'm happy to start.
So, go ahead, Rob.
So we see right now is really the calm before the storm, which has given us a chance to do a little more planning than we've had. Surge planning is a big part of it. We need to produce 300% more beds than we have currently in the model. And right now, looking at the predictive model, we're seeing that the influx will start late next week and then probably peak towards the second week of May. So we're trying to get working together with all the hospitals. Grace from Children's, the CEO there, leads our AHA board, and so our local hospitals are working together on a daily call, and the greater NICO region, which is the region 5 in the multiple county area, to continue for planning for making sure that we're organized as a team approach. And I think that we're still seeing issues with PPE. We have enough for current, but at this last several weeks, we will have difficulty with PPE as far as the masks go and the shields. Our early cases right now, we've had 5 cases at Western Reserve. The length of stay has been a little less than we've seen nationally. Nationally, they're running sometimes up to 17 to 21 days. We're seeing a lot less right now. Currently, that could probably change from that perspective. But right now, I feel that we're making good strides, but you can never prepare for something that this is a once in a 100-year situation. But I think that I'm really happy with how the health systems are working together. And I think that my biggest message to the employers in the community is that, the distancing is a huge part of how we continue to push this curve down. And I know sometimes people don't have symptoms. That's why it's important to make sure that we're keeping the distance despite not having the symptoms. That decreases the curve and gives us ability more time to control and to have more beds for availability. From that perspective, I'll turn over to Cliff here.
Yeah, so very similar. We're running about 50% normal capacity because we've eliminated all the elective surgeries, all the elective testing. The emergency rooms are about half of what they normally have been. We were asked by the governor at the beginning of last week to start considering expansion, and then over the weekend we were asked to all increase by 300%. So we've seen about a 240% increase in beds and ICU beds in our community between all the different health systems. One of the limitations is having enough ventilators and enough staff. We think we've got enough people to do the work. Specifically at SUMA, about 60 of our surgery nurses have gone back onto the floor and are learning to make sure they can do those types of skills. We're retraining all of our intensive care and cardiologists and other physicians how to take care of these patients. And so we think that you're seeing a good community response. I'd say we've had over 200 physicians step up and put their names on lists to take care of patients internally. We have resisted as a community of setting up an emergency hospital in the convention center or something along those lines, because all of the different health systems feel like we can use the current capacity of space that we have, and we've got the stuff in our hospitals and the people. And it would really put a strain on everybody if we were to create a decentralized or a centralized additional hospital. So we feel good from that standpoint. We are part of what's called Region 5, which is 13 counties, and we are working with the 13 counties from Youngstown over to Mansfield down to Canton collectively on how we'll handle the surge, where will patients go, and we've got different communication centers set up. And then we also are combined with the Cleveland and Toledo regions when it comes to National Guard response. They have been very helpful in that they're willing to help us on construction. They're willing to help us with logistics and moving things and transporting people. And then they've also offered to help us with food and food preparation going forward. Probably the biggest concern we have as a community is not a lot of these patients, as you've heard, get to the point where they need to be in an ICU, but they are sick and they may not qualify to be in the hospital. And so where do these people go to convalesce? So we're looking at different solutions from the old Edwin Shaw Hospital to some other facilities that have beds, that have linens, including dorms and potentially hotels to house some of these people as they get better. That's probably been the biggest strain on a lot of communities is where do these folks go? And if you don't have a good system to move them through, then the hospitals get backed up and then you limit the number of places for the new patients. And that's really what we're seeing up in Detroit is just the folks just keep coming, and if you don't have a way to move them through the system, you can get overloaded. So we feel good that everybody's working well, as Rob said. We feel that we've got a good system in place, and we're working, at all the different levels, whether it's local, Summit County, in the region, and then in the state. And we're blessed to be in Ohio because of the governor's leadership has been very aggressive since day one.
But thanks. We have got a number of chat comments here about some resources folks might want to provide and things like that. We'll make sure we connect those to the hospitals. Greg Kramer and our team has been working closely with Ed, Steve, and the other hospital execs to connect the dots on PPE and other ways to support. So we'll make those connections for you. Ed and Steve, I'm going to ask to hold off for a minute. We're going to come back on PPE a little later in the call, but I do want to get to Lydia Mahalik, who's the director of the Development Services Agency for Ohio. I know you're on a limited time as the governor's briefing's coming up here shortly, but Director Mahalik, do you want to just talk about some of the things the state has done recently to sync up with some of the COVID-19 changes in federal legislation, but then also some of the response orders that you guys have been working through? Director Mahalik, are you there? So if our team can see if we can get a hold of Director Mahalik, we can't seem to hear her on the call. Can somebody confirm for me I'm not the only one not hearing her?
I'm not hearing her.
Okay, great. Okay, so maybe we will stop back for her. Let me know if we can find her. Let me just go back to Steve and to Ed then. Guys, you guys have been very involved with our team in trying to source PPE, talking with manufacturers that have ability to help us in that space. Can you just give us a sense of what you're seeing and what some of the challenges are and successes maybe you've had? Steve, maybe we start with you.
All the headlines as people see on the news every evening. These are the caps, the gowns, the gloves, the masks, the face shields. This is the stuff that's in short supply for us. Now, most hospitals have established relationships with significant suppliers. A lot of the manufacturing is offshore, however, and that's created some challenges for us in having a continuous supply line. So what we're doing from conservation is really the key for us, and making sure we're using what we have appropriately. And the way we're doing that is really by following the CDC guidelines very particularly and pushing that down and making sure everybody's consistent with that. So first of all, that you're using what you have in the wisest manner possible. You'll hear some common themes throughout this that have already been raised by Dr. Dr. Devaney, Dr. Kent, Donna Skota already about, the shortages of PPE, what we're doing by actually curtailing and cutting out all non-emergent, non-essential procedures and pretty much closing down a lot of your outpatient facilities that do such procedures. It's another way you end up preserving kind of what you have and doling it out appropriately. From a sourcing perspective, actually my colleague Ed is an executive on the supply chain side for children, so I just asked him to weigh in. Ed? All right, not sure if we're getting Ed. So
Well,
a couple of areas actually that where we found collaborations that have been useful are folks who are stepping forward in the community from the manufacturing perspective, who've actually been great at reaching out to a lot of hospitals. Cleveland Clinic, Akron General, a lot of our colleagues in Summit County. There are a lot of great partnerships. Folks have reached out who use PPE equipment and have come forth and say, how can they actually help us in these situations? So what we're doing is we're taking all that information, we're centralizing it, and we're sending it to our supply chain people who basically vet every inquiry for us to look at appropriateness of the product, basically where it's originally sourced from, and how it can be best used, within the networks. That's one area that's been kind of a success story for us. The gaps we do have actually, though, are mostly from the masks, is what you'll hear. The regular surgical masks and then the N95s, these are the respirators. So this is the biggest shortage for us, so we're being very careful on how those are dispensed at this point.
Steve, thank you. And I know that if folks have questions about how they can help in this space, they can email us at covid19@greaterakronchamber.org. Greg Creamer and his team have been working very closely with all 4 of the hospitals to really connect with their folks as to how needs can be met, along with Magnet, Jobs Ohio, and other players in the economic development system that are really coordinating response and support there. I'm going to flip back over to Director Mahalik. I think we've been able to sort of get her live. So Director Mahalik, could you make some comments about the state's work in this space right now?
Sure, absolutely. Well, good afternoon, everyone. I'm hoping you can hear me now.
We can.
Okay, great. Thank you so much for asking me to join you on a very important call this afternoon. I think it's important for us to be able to continue to communicate to our stakeholders across the state so that you have the most accurate and up-to-date information. And I also think that this line of communication is certainly not one way. We certainly want to hear from you, and I feel like we have some existing lines of communication with folks across the state. So keep the questions and the suggestions coming forward as we all kind of try and work together here to figure this thing out. Well, certainly the executive orders that have been issued in order to protect Ohioans and try and save lives have definitely had a particularly difficult and stressful impact on Ohio's business community. And the governor and lieutenant governor are doing everything they can, instructing the cabinet to pull all their resources necessary so that we can take the steps in this particular crisis that can help support Ohio businesses and, of course, their employees in every way that we can. We are grateful for the business community feedback that we've received in the council on best ways to address certain things as they pop up. And with the stay-at-home order, it certainly provided some challenges for all of us. And I think it's important to note that every day we're working to try and support Ohio businesses in this space. We do have quite a few things that are available at this time, specifically, I would say, in terms of financial assistance, specifically from the federal government. And I think we're going to hear more about that later today. But I would say in terms of size and scope, and resource availability, the CARES Act certainly is a great first step in assisting particularly our small businesses as they navigate through this very tough time. We are in the process currently of putting together an effort that kind of brings together work that's already being done behind the scenes right now between our minority business assistance centers, our small business development centers, as well as our other partners, our MEPs. Currently, you certainly are aware of Magnet, and working with our partners at Jobs Ohio to try and make sure that there is a resource that is available for those who need help. Currently, right now, if you want to learn more about what the state's doing to help support businesses and workers, you can access all of these resources at coronavirus.ohio.gov/business help. And this particular resource is a portal that includes information on things like unemployment benefits, on the Small Business Administration's Economic Injury Disaster Loan Program, the state's liquor buyback program, which is proving to be very helpful to folks, modified rules, for example, for trucking to help with shipping critical supplies into the state, some work on BWC, et cetera. So keep going back there daily to coronavirus.ohio.gov/business help. And we hope to have more information for you as we continue to develop more opportunities. We are working with an economic strike force. We have calls with different associations in those stakeholder groups every Tuesday morning at 9 o'clock, where we get to share some of the things that we've been successful in doing. A lot of feedback has come in around regulation and policy changes that temporarily could be lifted or amended to try and help release the pressure that exists on business across the state. So we're doing our best in that space. And I know I also wanted to talk just a little bit about some of the initiatives that are included in House Bill 197, which is what was passed here in conjunction with the governor and the legislature. A tremendous amount of leadership has been demonstrated to get some things done that will be helpful for Ohioans. Things that you might be interested to know that are kind of highlighted in that particular legislative effort are things like student meals. So during this crisis, we certainly understand that access to food remains important for the many young Ohioans who may receive free or reduced lunches within our schools. And so we've asked that the legislature, and they've been granted, the legislature give the director of the Ohio Department of Agriculture, Dorothy Polanda, the authority to provide an exemption from food processing requirements so that those school districts providing meals to students who are home can focus exclusively on that service during the state of emergency. We've also done some things around distance learning in our education system. So under current law, schools are only permitted to use 3 days of distance learning when a school building is closed. Of course, we've made some modifications in that space as well. On the licensure extension subject, in order to try and limit large groups of people congregating in waiting rooms and lines, and then, of course, some unnecessary person-to-person contact, the governor has asked that all non-essential state employees actually work from home. And he's also ordered all but a few essential deputy registrar locations of the BNB to close during the COVID-19 crisis. So in light of this, we asked the legislature and was granted an extension in the renewal, application review, and other functions of the state's agencies and licensing boards for an additional 90 days from the date of the enactment of the bill. Other parts that might be interesting to you, we've now done this conformity with a federal tax deadline. So the tax deadline at the state level will now conform to what the federal tax deadline is. And we've also done some work on helping with municipal net profit tax as well. I guess, you know, the fact is that there's a lot going on at the state level, and it's all in an effort to try and be responsive to the needs of Ohioans. And I'm super proud of the leadership that's been displayed by our governor certainly he's leading the nation in some really decisive action to try and save lives and to get us out of this thing as soon as possible. And of course, the Lieutenant Governor by his side has done a wonderful job, and of course, Director Acton. We are here to serve, and we want to be responsive to your needs and concerns. So please continue to communicate with us, and I'll be happy to answer any questions here at the end.
Director, just a couple of quick questions before we shift over here a little bit to Congressman Gonzalez. One of the things I've heard the most about is the changes that have been talked about to allow unemployment insurance to be available to self-employed individuals and contractors. I believe as of yesterday afternoon, the site still said for unemployment that those folks were not eligible. Can you provide any insight on the timing of when those folks might be able to apply for that support?
So I can tell you that this is a priority for the administration. I'm not sure exactly in terms of what the timing looks like. I know that we're basically building out a brand new system to allow for this particular assistance. And I know that Director Hall with JFS is doing everything she can to ramp up and scale up so that we can meet the demand. I'm grateful that through the CARES Act that we've got some additional resources that are available to help individuals in this time. I think the more emphasis and impact we try to affect on individuals through this process, the better. And certainly Job and Family Services and Director Hall and her team are doing what they can to be responsive to those needs.
Great, thank you. I mean, I think that's folks need to realize, and I think all of us do, that it takes time to respond to all these changes. So we appreciate the efforts and the leadership from your team and from the governor and Lieutenant Governor on this. We also appreciate the local support that we've been getting from Christine Marshall and her office in Jobs and Family Services and Workforce. Being able to help move employees from places they've lost jobs to folks who are hiring has been critical. And so the support from that team has been tremendous as well. So we appreciate that. Director, I know you might have a time constraint here, but I know your staff is going to stay on for some of the questions potentially. I'm going to shift now over to Congressman Gonzalez. Congressman, thank you for joining us today. Thank you for your tremendous advocacy in DC for support for our region and for our businesses. And we'd love to hear from you about some of the things that are critical to the business community and the employer community as part of the CARES Act. Congressman?
Great. Well, thank you for putting this together. Thanks for having me for sure. I kind of want to piggyback off something that Director Mahalik just said. I would think that we in Ohio are incredibly well positioned, and I sincerely believe this isn't just sort of my Buckeye pride, but when I look at across the country and I look at how at every level of government, whether that's at the State House, whether that's with Eileen Shapiro, whether it's at our local level, we are seeing a tremendous amount of cohesion and policy being pushed that I think is ultimately going to help our community. I am convinced that when we look back on this a year from now, we're going to look, and the entire way we're going to say the state of Ohio led. The state of Ohio led with Governor DeWine acting very early. The state of Ohio led with all of our local and county and state government officials staying together. I like to believe we'll say that we led congressionally. We've been fully aligned, having our weekly calls with Governor DeWine and really working together. And maybe most importantly, I believe that we have the best healthcare system in the country in Northeast Ohio and Ohio writ large. And so I sincerely believe when we look back on this, we're going to be very, very pleased with what we've seen, despite the fact that we all know the next month is going to be pretty difficult. I suspect it's going to be psychologically a little bit challenging. The data is going to look bad and it's going to be painful and there's going to be tragedy, but you're going to see kernels of hope as we get towards the back half of the month and into May. So I just wanted to, again, thank everybody for being on the call and thank all the public officials for all the work that they're doing, because it's been really special. Obviously in DC last week, we voted on the CARES Act. And when I think of the CARES Act in this crisis, I look at it in sort of two ways. One, we have an economic crisis which has been caused by a health crisis, and the goal is to make sure that it doesn't become a financial crisis. The financial crisis was totally different from this. The financial crisis was a handful of banks who were bad actors who ultimately brought down the entire system. And then, right or wrong, we came in and bailed them out. This is completely different. This is, I would argue, much more akin to the government actually shutting down your businesses, sort of like an eminent domain, where we've said, hey, you cannot operate. The appropriate health response is for everybody to stay home, to practice social distancing, and it's sort of a government mandated recession. We're going to shut the economy down, not completely, but as much as possible, so that we can flatten the curve. And in that world, you create one of the biggest liquidity crunches, maybe in human history, where you have businesses all over the country and all over the world who now all of a sudden have seen funds dry up, but they still have bills to pay and all those sorts of things. So the CARES Act splits into two places. One is the health side, and I'll talk briefly about that. The second is the economic side. On the health side, I'd echo everything that was mentioned on the call with respect to the surges that we see coming and the lack of capacity that we currently have, both in a supplies standpoint, so on the testing and the PPE, but also with beds and ventilators and things like that. So a big chunk of the bill is basically designed to alleviate that. We know that if we don't solve the health crisis first, that the economic pain is going to be much more severe and the loss of life is going to be much more severe. So, so we did all we can to sort of backstop and to put in place resources and programs for our medical community. Frankly, if I'm being honest, I don't think we've done enough on that, but it's a good start. And I think that as we go forward, we're going to continue to fight for that. One area that I want to highlight quickly there is we put more money into what's called the Defense Production Act. You may have heard the president refer to this. This is something that I've been talking to him directly about, trying to get him to basically use his power to command production of certain things. Right now, not only at the state level, but local level and at the national level, you have this bidding war and competition for a very scarce resource, which is personal protective equipment. And that's driving the price up, and it's not doing anything about the shortage because there's only so much production in the system. Also mentioned, a lot of countries manufacture this domestically and they're not exporting it right now. They're keeping it at their home countries so that they can take care of their own people. So I want him to start activating that for PPE. He's done it on a couple different areas, but we're going to talk to the gentleman, Peter Navarro is his name, who's running that program for the White House, hopefully today or tomorrow, to put in a bug there. But that's sort of separate from the economic side, but I do want to highlight it and let everybody know that, at least with respect to what we're focusing on, we understand that until we solve the health crisis, the economic crisis isn't really done. You have to solve that first. And so we're going to put resources there and put a lot of focus there. On the economic side, I would argue that the SBA 7A loan program is one of the most generous and comprehensive small business programs in the history of the country. And I think that's what's required. Again, I would point you to the fact that we have shut the economy down. The government has done that to respond to the health crisis. I think that's appropriate. But when you do that, you have to backstop the small business community. Small businesses don't have the same resources and the same flexibility as Boeing or somebody like that. And so we need to help there. And so what we've done on the SBA 7A loan Paycheck Protection Program, and there'll be more information on this later, is provide $350 billion to support loans through a Paycheck Protection Program. That's 500 employees or fewer. And the size of the loans would equal 250% of an employer's average monthly payroll. So whatever your average monthly payroll is, 250% of that. Maximum loan amount is $10 million. And if you use that loan for payroll, mortgage interest, rent, and utility over an 8-week period, it'll be completely forgiven. So I don't give financial advice out, but I will tell you, when I talk to my father, who's a small business owner, this is what I'm talking to him about, because I think it's a very, very powerful program. There's also been some changes to the emergency program, the emergency disaster loan program. And the basic premise there is legislation establishes an emergency grant to allow an eligible entity who has not applied for an EIDL loan due to COVID-19 to request an advance on that loan. of not more than $10,000, which the SBA must distribute within 3 days. So that's one element. There's also, you can't double dip. You can't do the EIDL and the Paycheck Protection Program unless you're using them for separate expenses. So how are they going to track that? Honestly, I don't know. And if I'm guessing they're going to be very lenient because we all understand what the crisis is. The last thing, and I should have mentioned this on the Paycheck Protection Program, that's the 7A program, is that you're going to want to contact your bank as opposed to the SBA directly. So from an organizational standpoint, the way we set it up is these loans will be distributed directly by your bank. So you're not going to go to the SBA website. You're not going to call the SBA. If you've been doing that, you've probably noticed that the site's not working particularly well right now because it's getting overloaded. And that's to be expected. And so what we said is, hey, why don't we just distribute these through the banks? The banks already have the relationships with the employers, and that'll speed the process. Secretary Mnuchin actually has projected that the first loans will go out by the end of this week. So a pretty quick turnaround on that.
Congressman, can I just ask you a quick question on that? Because I think it's so important that we highlight this. The Paycheck Protection Program, the whole intent, as I sort of see it, is to ensure that employers can keep folks employed through this crisis. And if they have laid off folks, they can bring those folks back so they can get started up again when we can do that. But this is literally functions a lot like, as you said, a grant to employers to allow them to keep their payroll going through this period of time. So I don't think we can emphasize that enough for folks.
Yeah, and you're right, that is the goal. The goal is to say, hey, look, we want people to be attached to their job still. Even if you're paying them just to sit at home, for a handful of reasons. One, because it's better to be attached to your benefits. And then second, and I think this is maybe as important as anything, when we restart this economy, it's a heck of a lot harder to start an economy than it is to stop one. And so when we restart, we want people already attached to the work so that you're not having to go back out into the market and rehire and re-interview for jobs and retrain and all that sort of thing. So to the extent possible, we want people to stay attached. And that's why we have the program set up where it is, where it's a forgivable loan. It's basically a grant if you kind of use it for the approved expenses. So I think it's a really powerful program. And I'm really pleased with the design of that program, frankly. So that's on that side. Now, the second kind of component to that, again, a lot of people all of a sudden have cash dried up. There are quite a few folks in our country who have been laid off as a result. You saw the numbers come in last week, the biggest increase in the history of our country. Hopefully we never see it again. So one of my priorities was to expand the unemployment insurance program. And I was happy to see that we were able to do that. So traditionally, it wouldn't apply to self-employed independent contractors or those with limited work histories. In this case, it does. We've broadened the pool through December 31st of 2020 to provide payment for those not traditionally eligible for benefits. And then it also provides an additional $600 per week to each recipient of unemployment insurance or pandemic unemployment assistance for up to 4 months. And the total availability of unemployment insurance is extended to 39 weeks. So again, very generous with respect to that. If you kind of think through the math on that and what folks will be able to receive, I think it's a generous program, and one that, frankly, if this goes on for longer than we're currently looking at, I think you'd see an extension of that. On the business side, two tax provisions I want to highlight. Employee retention credit. So bill provides a refundable payroll tax credit for 50% of wages paid by employers to employees during the crisis. Credit is available to employers whose 1, operations were fully or partially suspended, or 2, gross receipts declined by more than 50%. And then there's a delay of payment of employer payroll taxes. So the employer share of the payroll tax is delayed for 2 years. You have to make up 1/2 by December 31st, 2021, and then the other half by December 31st, 2022. And then the final point, and I'll stop here, is with respect to the bill is the recovery checks. So these, you've heard about checks in the mail. So that's recovery checks up to $1,200 into the hands of most taxpayers. They start to phase out after $75,000 in adjusted gross income or $150,000 for joint filers. And then there's an increase of $500 per child as well. We suspect that those will go out by the end of April, if not sooner. And so that's kind of the CARES Act. Those are the areas I'd outline. The last thing I'll say is I think we are in the third inning, the fourth inning, however you want to think of it. We're not quite halfway there. And when we think of next steps and next pieces of legislation, the areas that I would like to highlight that I think are still gaps based on what we're seeing. One, we're still going to have to invest on the health side. On the economic side, I think there's a chance that the money we've allocated for the 7A program isn't enough. We'll have to plus that up. And I think there will be an appetite for that. The next thing I'll say is our state, local, county governments, their tax revenues are getting absolutely crushed right now. And so they're going to have big holes in their budget that they need to fill. And I believe that an appropriate place for us to look to provide additional assistance is at our local level, because the reality is they're already fighting tough budgets. And so to have this sort of crisis without any sort of backfill on our side, I think would be wrong. And so that's an area that I've talked to some of my mayors about, just to assure them that that we're going to be fighting for that as well. And then finally, there seems to be alignment from the speaker and from the president on potentially picking infrastructure back up. I could see that. If you had asked me 3 months ago, I would have said probably not. But there's likely to be a world where even when we restart, we're still looking at some pretty high unemployment numbers. And there could be an appetite for a broader package there. So with that, I will pause and thank you, as I said at the outset, for putting this together, and thank you for everybody on the call for all the work you're doing. We need everybody, and everybody's stepping up, so it's great.
Congressman, thank you. You know, the approach that you've taken between the business support, unemployment support, it does create, I think, that kind of systemic support, so people can take a breath and sort of understand that a lot of these things are places where they're going to potentially get help. One of the questions that we had that came in during the call was a lot of discussion about the reduction of seasonal staff as a result of being closed. How are seasonal staff dealt with in the calculations? Do you have a sense of that?
Is Stephen from my staff on? I may call him in if he is. He's not.
Well, we do.
Yeah, he's on. There you go. Stephen, you want to grab that?
So there is a different calculation for how much is available for seasonal workers compared to non-seasonal employers. So the maximum loan amount for a seasonal employer, let me just pull it up, is the average total monthly payments for payroll costs for the 12-week period on February 15th, 2019 through June 30th, 2019. So there's just a different formula that they use compared to non-seasonal employers. If I think that's the question that's being asked.
Yeah, that's helpful. And I think there's a lot of accounting and legal professionals that have been monitoring this. So your accounting legal professionals can help you through this, I think, get to that answer. One other question for you, Congressman, or for Stephen. You indicated loans will start to flow potentially this week, and I'm assuming that's some of the EILD loans. When are the banks, do you think, going to be in a position to take applications for these expanded 7A loans, or is the typical process for that what's going to be used?
So I was actually referring to the 7A loans in terms of the distribution this week. So what we've been told, and again, I'll apologize if you're asking questions and we say, hey, we'll have to get back to you. We passed the bill, and now it's the executive branch's time to figure out what the heck we wrote and put it into practice. But and so they're going to articulate those rules sometime in the next day or two. And so once we get them, we'll disseminate them. Having said that, the Treasury Secretary has said that he believes the 7A loans will be distributed starting end of this week through the banks. And so my advice would be, if you're interested in that program, to be talking to your banks now. Don't wait. Get on the phone now. A lot of folks are probably already doing that. And just get the ball rolling so that as soon as these rules are articulated, you can get your meeting, you can get your paperwork, and hopefully get the loans turned around within 1 to 3 business days.
I think this is known by a lot of folks, but as you're thinking about these, especially if you're a smaller business owner or a mid-sized business owner, you need to be talking to your banker through this process. You need to be talking to your creditors through this process, because they all are getting different levels of support and relief in different areas. But you need to be asking. I was talking to Bob Filipiak today at Cascade Capital, does a lot of SBA lending work. You have to ask for the deferrals. There are also some provisions in CARES Act that'll provide 6 months of loan forgiveness as well for SBA loans. So if you have a current SBA loan, please be reaching out to your SBA banker to ask for those things because there is a lot of support available in the CARES package. Congressman, thank you to you and your colleagues for the work that you did to make this happen. I know it was not easy, and I know you guys are in sort of, I think the word unprecedented is being overused these days, but the response is also unprecedented, so we appreciate that. I think we've handled some of the questions that have come through. As I said, a lot of the resources that we're talking about are on the sites, the GAC COVID-19 site. There will also be a recording of this discussion available there as well. And if you have questions that you can't otherwise find answers to, COVID-19@greaterakronchamber.org is where you should send those questions, and we will get them connected to the right people. We really appreciate all of your help today and all of the comments from the folks that we've had on the line. With that, I think we're going to close our call unless we have any additional information or questions that people want to put out there for this. There is, again, the website at gaccovid19.org. We also will be beginning next week some new, more online virtual programming and education for our members, so please stay tuned for that. And again, thanks to all our guests today, County Executive Eileen Shapiro, Donna Skota, Dr. Devaney, Dr. Kent, Steve Abdenauer, Ed Lehner, Lydia Mahalik, and Congressman Anthony Gonzalez. We appreciate your support, and we will continue to try to bring information and resources to you as we go through all of the issues related to COVID-19. Again, have a great afternoon, and we appreciate you joining us today. Thank you.